Hello, classmates. Well, I am officially back from Japan, and I am currently sitting in my childhood bedroom at my parents' house. There's roughly a picture of 11-year-old me with my family on the wall for proof. For the practice experience, the care model that I reviewed is a vertical care model, which, as we have read, is a more bureaucratic form of care, but it also has very clear delineated paths of communication. And personally, I prefer that to a horizontal model of care because of those clear demarcations in communication. If you're a nurse manager, you know you have people like me in my current position as a staff RN under you as who you manage, and then at our hospital, the nurse manager reports directly to the nurse supervisor. So if they have difficulty with something such as staffing, or if patient census is low and we're maybe calling people off, they would communicate directly with the nurse supervisor. If there are certain medications or equipment that we can't get, my nurse manager would initially go to the nurse supervisor as well. And then up the chain of command, it would go from there if the nurse supervisor can't make it happen. So I like those clear-cut paths of communication. On the leadership skills questionnaire, as anticipated, I scored highly in interpersonal skills because one of the things I like about my job is working with people, whether that's my patients or the other nurses that I work with. And I think as a nurse manager, I would continue to like working with people, but what I would really not enjoy or not prefer would be the administrative side, which was also the part of leadership skills questionnaire that I scored the lowest in, and that is also probably very much related to the bureaucracy that you get into when trying to enact change, trying to acquire resources, and those types of things. I know one of the questions was regarding, I think it was 13 or 16. Yeah, obtaining and allocating resources is a challenging aspect of my job. I would very much agree with that. If I was a nurse manager, I do think that would be difficult. And one of the resources that the prompt asked about was staffing. And at our hospital, that is a particularly large challenge because we are in a military town. So many of our staff members, including myself, are the spouses of military personnel. And sometimes that requires you to move on short notice. And therefore, your job may not have a lot of forewarning. You know, we're required to give at least 2 weeks. But for military spouses, I've heard of occasions where you've had to move and you have a month's notice, maybe. And it takes longer than a month to bring a new person onto our floor to train them. Just to train them, it takes 6 weeks, even if it's an RN who has experience. So coordinating staffing and recruiting for staffing at our hospital is a really big challenge that our nurse manager and that I, as a nurse manager, would have to deal with. So a lot of the skills that were discussed for a nurse manager really come into play in that scenario because you have to do a lot of planning to recruit staff, to figure out if you're short-staffed in the meantime, how you're going to handle that. Are you going to float people? Are you going to ask your PRN people to take on more shifts? Are you going to require your regular full-time staff to be on call more, or to take on an extra shift every other week? Just how are you going to fill in those staffing gaps? So that's something that you're going to have to do a lot of planning for, in conjunction with who your charge nurses are and in conjunction with the nursing supervisor, because a lot of that's going to really depend on, for us, what our patient census is. Let's see. In regards to the transdisciplinary care model, I reviewed an article on the collaborative transdisciplinary team approach for dementia care from the Journal of Neurodegenerative Disease Management. And this is something that's really important on our floor because we get a lot of patients who do have Alzheimer's or dementia, but they're typically admitted for something else, such as congestive heart failure, kidney failure, chronic lung disease. I have a lot of patients who have chronic health conditions who are going through an acute exacerbation on our floor. So the fact that they have dementia or Alzheimer's is generally not something that is front and center for us. So there's not a lot of transdisciplinary care directed at treating that. And I think that one of the difficulties with enacting transdisciplinary care for those patients on our floor is the fact that they come in with an illness that is, you know, in the degree of illnesses, more important at that time. So the Alzheimer's, the dementia gets kind of pushed to the side. But if we were to enact transdisciplinary care of dementia or Alzheimer's patients, as a nurse manager, I would probably want to develop a policy and procedure for that, which would mean that a lot of coordination would be necessary. I would need to talk to the nursing supervisor and probably the nurse managers of other units, because this would need to be something that was enacted across all the floors of the hospital, and it would be something that we'd have to convince the medical staff to adopt, and something that we'd have to recruit staffing for assessing the patient as to how advanced their dementia or Alzheimer's is. And one of the things that this article talks about, the name of the article is Collaborative Transdisciplinary Team Approach for Dementia Care, by Galvin, Valoy, and Zweig, and it was published in 2014, December of 2014. And one of the things they talk about a lot is caregiver role strain and treatment plans developed in conjunction with the caregiver. And that's really not something that we do. So we don't have the staffing to even assess the caregiver at this point. So this would be something that we would have to build from the ground up. So to secure resources for that, it's, again, like I said, we would have to build it. And that would be something that we'd have to go to the nurse manager, and the nurse manager would probably have to go all the way to the top of our organization and talk to the director of our hospital to convince them that this is something that we need to spend money and resources on. Right now, I think we kind of try to do it on a small scale. If we notice that there is a problem, if we notice that the patient is neglected, if we notice the caregiver has role strain, or if we notice that a lot of times we get patients who seem to have dementia or Alzheimer's, and the family, they haven't been officially diagnosed because the family kind of says, oh, they've just been confused lately, or they're getting older and they're forgetting things. So a lot of times we do consult interdisciplinary team members to get that patient seen more and maybe an official diagnosis made, but there's no long-term care plan for that. As far as my role as a nurse manager on my floor, from what I see, I think we have a great nurse manager, and she does a lot of motivating through, we have monthly staff meetings, but she also comes on the floor a lot early in the morning and talks to everybody and kind of assesses the staff and sees how the staff is feeling about how everything's going. She communicates a lot. There are signs in the break room, there are signs at our nurses station, and she also uses email, and we can send messages through our scheduling service, which is Shift Wizard, and she communicates with us a lot through that. And then we have check-ins with her at least every 3 months where she talks to each member of the staff individually to see how they're doing. And she has an open door policy. So she makes, I think, a good effort to communicate with us. We have minimal supervision on night shift, and mostly she communicates and liaises with whoever the charge nurse is for the evening. And the charge nurse, if the charge nurse has any sort of problems during the shift, she would consult the nurse supervisor, or she would call our nurse manager at home. We do experience a lot of communication as to whenever there's a change in policy and procedure or a change in staffing. It's communicated to us as to what's going to be changing, what the expectations are for our rules, and how we need to troubleshoot it if we have a problem implementing anything. If we were to enact a new policy and procedure, such as this transdisciplinary care for dementia patients, we would need to coordinate with other managers on other floors, the nursing supervisor. We would need to coordinate with the medical department, because these would be their patients. The education department for the training of our staff. Would there be computer-based learning that we would all have to do? We have to go to a class. Maybe need to coordinate with IT, because maybe this is something that needs to put in the electronic medical record that would trigger implementation of a protocol if it's found that this person has dementia and would benefit from this transdisciplinary care model. The controlling aspect would be setting dates for education to be completed by, setting expectations for adherence to the model, and also any follow-up if it's found that someone is falling short, not meeting their expectations, addressing that to make sure that they're brought up to compliance. Planning would be planning for this change. What would need to be changed in the electronic medical record? What plans do we need to make for training? Is there going to be any on-the-job training? Like, sometimes they come around and do a brief training session during our shift. Sometimes we have to go to an however hours many long class for training. And then if this is something that a manager wanted to do, a big part of the organization would be organizing their idea of what this implementation should look like, how they're going to approach the nurse supervisor, how they're going to approach the medical staff to advocate for this idea, what their argument basically is going to be for pro-development and implementation of transdisciplinary care for dementia patients. Let's see. And I think, as I stated earlier, I prefer the vertical structure because even though there's bureaucracy, the lines of communication are more clearly delineated. And that's something that I appreciate, because I think when you have horizontal paths of communication, a lot of times it's like democracy that we discussed earlier. You get too many cooks in the kitchen and decisions cannot be made as effectively. So that's me. As I said earlier, I think that I could be a successful nurse manager, but I'm not sure that that's something that I aspire to right now. Again, I've been a nurse for less than a year, so I anticipate that things will change as I learn more and grow in my profession. But currently I prefer the vertical organizational model. Thank you.